Today, I'm going to be sharing with you the biggest cause of multiple sclerosis. I'm going to share compelling evidence that multiple sclerosis is an infectious disease caused by a parasitic infestation. And what that means is if we know what causes MS, then we can actually recover from whatever's causing it. So if MS is caused by infections, we can recover from infections. And many people have done this. This is what I have done myself. Over 35 years ago, I was diagnosed with multiple sclerosis, and I'm happy to share with you that I've been able to live MS-free from learning what I am going to share with you this evening on this live event. So as you have questions, make sure to type your questions in the question box and I will address them as we're going through the research. If we haven't met, my name is Pam Bartha. I'm the author of Become a Wellness Champion and the founder of Live Disease Free. I was diagnosed with multiple sclerosis over 35 years ago. By the grace of God, I learned early on that I was dealing with an infection, a chronic infection in the body. Back then, we didn't know very much about the types of infections that were involved. We've learned a lot, and that's what I'm going to share with you on this video. So this information is life-changing. It is science. It is absolutely awful that our healthcare professionals that are trying to help us, that they don't know this. So it's your responsibility to share this with practitioners, to share this with other groups, to get the discussions going. The more we talk about the true cause of multiple sclerosis, the biggest cause, the true cause, then the sooner we will have a cure. Yes, a cure. So I do have some amazing slides. I'm just going to head over to the slides and share those with you right now. All right. Let's see, here we go. Perfect. Okay, we're good to go. So again, the topic for today is the biggest cause of multiple sclerosis. And the research that I'm going to share with you, it's not just current research, it's research that has been going on since, I would say, at least 100 years or more. Some of the studies back to the late 1800s, early 1900s. So it's really sad that all of this research, this evidence has been lost, but not for good, right? So everything that I'm sharing with you is solely for educational purposes. It's not intended to replace the necessary measures of your healthcare professional. It's really designed to teach you how to play that active role in your healthcare so that you can reach your health goals. And because we do come together with serious chronic diseases, it's really important that we do talk with our practitioner about this, share this information with them so that they can help us. When I was just 28 years old, my immune system started to lose the battle. So from the moment that you're born until the moment you die, there is this battle going on in your body, a battle between your immune system and disease-causing microbes. So I thought I was a healthy person when I was young, but I realized, at the time when I was diagnosed with MS, obviously I was dealing with these infections. And that is really where my immune system no longer was able to keep them under control. And so that's when I was diagnosed with multiple sclerosis at the age of 28. But I'm happy to share with you that by the grace of God and a lot of diligence and research on my part, I have been able to live now over 35 years free of multiple sclerosis. And I'm going to share with you the exact things the steps that I took and others are taking, but also the evidence of what I am saying so that you know that it's true. So I've also dedicated my life and my career to help others in their recovery of chronic diseases. So this is actually a picture of myself back in 1988. Don't you love that big hair of the 80s? Yep, that was all mine. And at that time, I was a young, slim, active mom. I had been healthy all my life. And one sunny Sunday afternoon, I ended up with this spot in the center of my vision, and I rubbed my left eye. It wouldn't go away. By the second day, it got worse. By the third, fourth day, it was a complete blackout. It was like I had a patch over my left eye. And I did go to see an eye specialist in our hometown. And then I found that they quickly referred me to the University of British Columbia, Canada. It's on the West Coast. It's an MS University Hospital Clinic. I was rushed there because it was such a severe case of optic neuritis. And so I got to see a neurologist, one of the leading neurologists in Canada, really quickly. And he did all of his tests, and he said that I had multiple sclerosis. So I was like, well, what is multiple sclerosis? He said, well, it's a chronic disease that completely disables you in time. You end up in a wheelchair. It just gives you complete disability. There's nothing you can do. There's no cure for it. I was really in shock because how can you go from being a totally healthy person? Many of you guys can relate. Let me know if you had an attack like that and you thought you were a really healthy person, and then all of a sudden you've got this incurable, mysterious disease. So that was my case, and I was just 28 years old. And when I left his office, actually, let me backtrack. He said, I'm going to tell you about people are going to tell you about all kinds of snake oil cures, but as the expert, I'm telling you there's nothing that you can do to change the course of your life. You will be completely disabled in time. So I left his office completely devastated. I thought that my life was over. We drove home from the coast back to our place through the mountain pass, and it poured rain, and I cried all the way home. All I could think about was how was I going to take care of my family, my 2 young children, what a burden I would be to my husband. And I was really scared. I was really just felt completely devastated. I also had not just the optic neuritis, a very severe case of optic neuritis, but I had some tingling in my legs, some weakness in my legs. I had terrible insomnia, really bad headaches. It really flared up over those 3 or 4 days before I ended up seeing a specialist. And so when I got home, I was very fortunate that my mom could step in and help me and take care of my kids because I could not take care of myself, let alone, or my children. And so I had all those other symptoms, and I did have the support. The only hope that I truly had was my faith in God. I had asked for a lot of help in the past, and God answered a lot of my prayers. I've had a lot of miracles happen in my life, and it's not that I'm special, it's just that I do a lot of asking. And so I just begged for an answer. I begged for help. I did not know if I'd be cured, or I didn't know what the outcome would be, but I just had faith that somehow God was going to make good out of this horrible situation. And so shortly after my diagnosis, my mother-in-law, who was in a different province, she found this book. And this book talked about multiple sclerosis, and she didn't really understand what it all was dealing with, but she thought, oh, well, this might help Pam. So she gave me that book, and that book was The Yeast Connection. And that book started me on this journey because that medical doctor, this was around 40 years ago, was talking about how chronic silent infections in the body, how they cause disease, multiple sclerosis, but all other chronic diseases also. And as they treat, and they really focused more on Candida back in the day at that time, but as these infections are treated, their patients were recovering. So that was like, wow, there's hope here. So I decided to take that different path. I decided not to follow the standard of care for treating multiple sclerosis. I decided to take a different path to try to figure out which infections were causing the MS in my body. So I have had a lot of success. I was able to basically arrest the multiple sclerosis after that really significant optic neuritis. I did not get back all the vision in this left eye. So this left eye, I can't drive with it, but nobody else can tell, but it's definitely damaged. I didn't have any coaches. I didn't have any guidance. It was just literally just prednisone right back in the day. So, but fortunately, I never had another MS attack. because right away I started to learn, I started to implement, and through a lot of trial and error of safe things, I found that I could arrest the symptoms of these infections. But then over the years, we've learned so much about the different types of infections. So I'm going to share with you the science today of what we know at this point of some of the main culprits that are involved in multiple sclerosis, but also other neurological diseases, other chronic diseases. And so this all gave me, back in the day, it gave me a glimmer of hope that there was something that I could do to change the course of my life. And I really hope that this is going to give you that same hope. So again, I have now lived over 35 years free of multiple sclerosis. I've had another child. He is having his own third child. He's married. So I now have 7 grandchildren, and 1 is on the way this year. And I've had the amazing privilege to coach thousands of wellness champions all over the world, helping them to recover from these infections that we're going to talk about today. So it's not just me. There's many others that have recovered from these chronic infections. We call them silent because we don't have good tests. They're really hard to detect with our current standard of care. And this is truly why I am so passionate about this, is because I truly believe that there is a better way for you. I truly believe that there is a way that you can treat the root cause of what you're dealing with, and whether it may be MS, it might be some other disease, but there is a cause. And we do know what the cause is. We don't know exactly which infections you have, but it's not that hard to figure out. But if you at least get on the right path of that, yes, there is a cause, let's figure out which are the infections, you can get your life back too. And that is my hope for you. That is my dream for you. So I want you to, and this is really about us moving away from managing sickness and moving towards creating health, right? So that's what I did, is I created health in myself. I thought I was healthy, but definitely was not as healthy as I am now. And so it's also about becoming a wellness champion. And wellness champions value wellness and making a difference in the lives of others. So we build our health on 4 pillars. Pillar number 1 is to optimize nutrition. Pillar number 2 is to minimize these infections, these silent infections. Pillar number 3 is to minimize your toxic load. And pillar number 4 is to build a healthy lifestyle. So as we learn these pillars and we implement them and we apply them in our life and we get better, we recover, then we share this wisdom with other people in our lives, our coworkers, our family, our friends, people that we love. This is the only way that things are going to change, is from a grassroots effort of people helping people, sharing this information. And there's a lot of information. So on this presentation that I'm sharing with you, this video, I'm going to focus on the silent infection part, because truly that is the biggest missing piece of the puzzle. That is really where people don't have the skill, they don't have the knowledge, practitioners don't also. And so if you have questions, go ahead and ask your questions. I will, if there's time permitting, I will answer your question. So this image here is a true picture of microbes that live in our mouth, nose, throat, parts of our urinary and reproductive system, but especially in our digestive tract. These areas in our body are coated with these microbes. The surface area of our GI tract is at least the size of a double tennis court. And it's coated with trillions of bacteria and other types of microbes. And it's estimated that there could be at least 2 to 3 pounds of these microbes in our digestive tract, and at least 10,000 different species of microbes. So really it's an ecosystem. It's like a rainforest. And if we have a healthy ecosystem, the majority of these microbes, they should be health promoting microbes. We like to call them the good guys. So these good guys, they keep the disease-causing microbes in check. The good guys, they also help to digest our food. They make vitamins for us. They act as our natural defense. They modulate our immune system. They also are huge in impacting which genes are turned on and off. So they impact the expression of our genes. They have many, many other jobs. The bad microbes, on the other hand, they're called disease-causing parasites. They live inside of us. They steal nutrients from us. They produce toxins. They cause inflammation. Inflammation is war. It's where our immune system is fighting these infections. And so they cause a lot of harm. They cause a lot of inflammation. They make us sick. They need us to survive. And these types of disease-causing microbes would include worms, protozoa, fungi, and bacteria. Understanding how the good and bad microbes that live in our body, how they impact us in health and sickness, is the most heavily researched topic in science today. And our job is to keep the population of the health-promoting microbes up, keep the population of the parasites or disease-causing microbes down, and maintain a healthy and strong immune system. And the better we are at doing these three things, the longer we will live and the better quality of life we will have. So it's true that antibiotics have saved lives, but the overuse of antibiotics is the single greatest factor that has devastated our healthy ecosystem. So when we take a broad spectrum antibiotic, we not only target the bacterial infection that was making us sick, that gave us the sore throat, gave us a cough, fever, but the antibiotic also destroys our natural defense, the good guys, that protect us and keep us healthy. Many disease-causing microbes are not impacted by antibiotics, so when the good guys are gone or they're decreased in numbers, the bad parasites now have lots of room to grow. They thrive when we eat. Take a guess. What do you think their favorite food is? If you've been following me, you know. Their favorite food is carbohydrates and simple sugars. So things like breads, noodles, white rice, baked goods, cookies, cakes, all kinds of processed carbohydrates, but also drinks that are high in sugar. So this would be the perfect food for the bad guys, and that really allows them to grow more quickly. As the bad parasites, the disease-causing parasites, as they grow in numbers, dysbiosis occurs. Dysbiosis means that we're out of balance. We have too many disease-causing parasites and not enough health-promoting microbes. So now the good guys can no longer protect us. They can't defend us. The sicker we are, the more out of balance we are. And then we have silent infections, which are chronic, slow-growing infections, and it really depends on a lot of factors how quickly they grow, but they are generally slow-growing. It can take years before we end up with substantial symptoms, but they're in our body, and our standard of care, healthcare professionals do not recognize them or test for them at this time. So many of us suffer with these silent infections, and we experience a continual decline in our health as these infections become more populated in our body. The bad guys produce all kinds of poisons that make us sick. And again, there are worms, there's protozoa, there's fungi, there's bacteria. These are all different types of disease-causing bad guys, pathogens. So if we just look at, for time's sake, we're just going to look at fungus. And we know that there's at least 300 different types of fungi that can cause disease in humans. Some of you might be familiar with Candida. Candida is a type of yeast, which is a type of fungus. And there are many different types of species of Candida. And I'm just going to focus on Candida albicans, just so we get a sense of what one pathogen, the problems that one pathogen can cause in our body. So when Candida is present in small numbers in our body, it's not a problem. But when it becomes more populated in the body, it can produce large amounts of different types of poisons, such as ethanol, which is a type of alcohol, which causes brain fog, memory issues. It can make us feel like we are drunk. There actually is a medical term for this. It's called autobrewery. And Candida can also produce a lot of different types of mycotoxins. Formaldehyde is one example. Neurotoxins like acetaldehyde, which is the hangover chemical, which makes us feel like we are hit by a truck, like this poor lady in this picture. Candida infections can also cause leaky gut as the lining of our gut becomes damaged from the inflammation from the war, our immune system fighting these Candida albicans. And this can lead to food sensitivities, especially to things like gluten and dairy, but many other food sensitivities also. Candida produces organic acids. Some of us realize that we're acidic and we don't know why. And these parasites can produce a lot of organic acids, making us acidic, but also deficient in minerals. So when we treat these infections, we can notice a really big shift in our pH pretty quickly. Candida can suppress the immune system by producing enzymes that destroy our antibodies, which makes us more susceptible to other infections. Yeast can also produce chemicals called leukotrienes, which are involved in asthma, where we have inflammation in the lungs. We have the constricting or tightening of the airways, and lots of mucus is produced. Yeast can produce prostaglandins, which we find it's another molecule that's found in migraines, menstrual cramps, endometriosis, and premature labor. So prostaglandins are the pain chemicals that are produced by the body in response to these infections, but also directly by these parasites, microbes themselves. Inflammation is always present in any type of disease. The primary job of our immune system is to defend us from parasites. Inflammation is the war that takes place when our immune system is battling different types of parasites. So I've documented all of this in my book, Become a Wellness Champion, which you can find on our website, livediseasefree.com. The book again, Become a Wellness Champion, on livediseasefree.com. And what's really hard is that our youngest children are hit hardest by the toxins produced by these different types of infections. So they can produce chemicals like ammonia, amphetamines, morphine-like substances that really impact the mood and behavior of our children. These infections are a really huge part of the learning and behavioral disorders that we see in our kids today. Experts years ago, when I was still with the school district, there was a study that came out and said that 50% of our children have a health condition, and many experts predicted at that time, which was a long time ago, that many parents would outlive their children. Brutal. So we see in our students that are adults that have chronic diseases like multiple sclerosis, they pass a ton of different types of larger worms. So very often big roundworms. They do have tapeworms. That was documented even through Dr. Alan McDonald. Also, the flukes are really a lot more common than we ever thought, and they're a real pro-inflammatory flatworm. They can be anywhere from 1 inch up to 3 or 4 inches long, and they're about, if they're longer, like 3 or 4 inches long, then they might be like 1 centimeter wide. There's also we're going to talk about some of these. So there's different types of protozoa, which are single cell parasites. So there's a huge link with MS and malaria, babesia type protozoa that infects our red blood cells. Actually, they think that MS is more of a vascular disorder than an autoimmune disorder, with all of the vascular issues that we're dealing with MS, and it makes sense when you have a parasite infecting your red blood cell. And then there's bacteria like Lyme disease, Borrelia, which is really commonly linked. So I'm going to show you the evidence of all of that, the big worms and the small critters, and Candida. That was like the first type of microbe that I was introduced to 35 years ago. So after my training, if you don't have MS, you have a different condition, you can go and do a Google search. You can look at PubMed and look up your condition with infection, chronic infection, parasites, and you will find tons of studies that are current linking your condition to different types of infections. And then you can also go to our website, livediseasefree.com. In the main menu under research, you'll see that there are a lot of different studies I've put together that you can share with your doctors. Watch the little video, the lecture by Dr. Alan McDonald, where he found those roundworms, which we're going to talk about here in a minute or so. So I'm giving you all this evidence, and I'm sending you out into the world, and like, go talk to your doctors, talk to healthcare professionals. Some of them will listen, some of them won't, but just talk. This is how things are going to change. And scientists have discovered that there are at least 17 different ways that these infections, these parasites, cause inflammation and immune dysfunction in the body. Silent infections and dysbiosis are epidemic today because of the overuse of antibiotics. So you might be wondering, do I have these infections? How can I tell if I have them? And how do I treat them if I do have them? Well, these are 5 common questions that if you answer yes to even one of them, you likely have these chronic silent infections, parasitic infections, you're dealing with dysbiosis, your microbes are out of balance. Number 1, have I used antibiotics in the past? For me, it was years ago when I was a child, when I was really young, but especially when I had acne. I was put on tetracycline for acne. So maybe you haven't used antibiotics for many years, but the damage was often done before the age of 10. Number 2, have I had a cortisone type medication or blood pressure medication in the past? A lot of medications will suppress our immune function, which will make these parasites grow more quickly and become more abundant in our body. Number 3, for females, have I used birth control pill or hormone replacement therapy? Whether it's bioidentical, whether it's synthetic, we know that hormones are very powerful chemicals, molecules. They really impact the biochemistry in our body in ways we don't fully understand. And so when we take hormones, 2 things that can benefit the parasites. Number 1, the hormones can cause an increase in our blood sugar level, which will feed the infections because their favorite food is sugar and carbohydrates. And these hormones can cause the immune system, the inflammatory part of the immune system, to be suppressed. So that would be like acting like almost like a steroid type thing. So there we would have also, that would benefit the parasites also. So what we see in women is that sometimes doctors think that their patient is dealing with hormonal issues when really they're dealing with these parasites, which fluctuate at different times of the month. So in the last, I'm not going to go too deep into it, but basically when progesterone is higher, our blood sugar level is higher, these parasites are more active, so we have more symptoms, and then doctors saying, oh, it's your hormones, when no, it's just the parasites are more active. So when we take a lot of hormones, then we increase our risk for inflammatory conditions like arthritis, fibroid cysts, and polycystic ovarian syndrome, endometriosis, all kinds of other conditions. And if we have other parasites that are causing other diseases, it just enhances their presence in our body because it's giving them better growing conditions. Question number 4, did my mother currently or in the past before I was born show symptoms on this next slide? Did my mom take antibiotics in the years before I was born? Number 5, do I suffer with one or more of the symptoms on the next slide? Strong cravings for bread, sweets, chocolate, and alcohol. Digestive complaints, gas, constipation, diarrhea, irritable bowel or inflammatory bowel disease, abnormal fatigue, brain fog, memory or mood issues, allergies, sinusitis, eczema, asthma, chronic disease. So you'll notice that as we go down this list, we start off with symptoms that are more of a nuisance, and then further down the list, we end up with symptoms that are or diseases, like full-on conditions. So this correlates or relates to the population of these parasites in our body, like how infested we are. The more infested we are, the more serious health conditions we have. So at first we might have things like allergy, eczema, asthma, and then or psoriasis, and then down the road we might have things like arthritis or multiple sclerosis, Parkinson's, ALS, PLS, Alzheimer's disease. So those are down the road higher levels of infestation. So we do have a strategic plan on how to recover from these infections. I'm going to go more into the detail of the types of infections in about a minute or so, but I wanted to give you some hope before we do that, because it can be pretty overwhelming when you go, oh my gosh, I probably have all these worms, and I probably have bacteria, and I've got protozoa, and I've got fungus, and then maybe viruses too. Like, how am I going to get all of these big worms? How am I going to get them all out of me? Like, is it too late for me? And no, it is not too late for you. That we've had people that have been really, really sick. I would say that today people are sicker than they ever have been for various reasons, but there is hope for you. This is the plan. Number one, we first follow the Live Disease-Free diet, which is really low carb, which decreases the food to the parasites, gives our body a lot of nutrition. You'll find all of the guidelines. They're free on our website, livediseasefree.com. On the main menu under research, they're all there. I did an event last week about the Live Disease-Free diet, so you can go to that. There's lots of free resources on the diet. Start to decrease your carbs. It'll be life-changing for you. So you have that for free. Number two, supporting the body. So before we start treating, we want to make sure, again, the carbs are low enough, the parasites are less active because they're not getting as much food, the inflammation starts to go down, we feel a lot better. We're working on making sure we have daily bowel movements before we start treating. We don't want to kill the parasites and have them decomposing in our body. Then we also want to make sure that we're sleeping well. If we're not sleeping well, our immune system is so weak and it's not going to help in the fight. So very important that we support the body, that we're feeling a lot better. It does a lot of natural immune modulation. Then we can tolerate the treatments better. Step number three is to treat the parasites and reestablish the health promoting microbes. So this is really where we focus in the Live Disease-Free plan, and we use a combination of parasite drugs, herbs, and oxygen therapy. So all three are essential for recovery. We have not found that we could just use one or the other. You need all of them over multiple cycles to recover. And then once you're well, step number four is to manage your health, and that's what I've done for 35 years now. I'm able to go horse riding. I'm able to play hide and seek with the grandkids. I'm able to, my granddaughter was teaching me ballet last Friday. I'm able to run around like doing musical chairs, Big Bad Wolf, like just doing all kinds of activities, whatever I want to do. But it's because I learned how to manage the microbes in my body. I first treated them well enough, and it's not a one and done deal, because you will knock the parasites back so far that you become symptom free, but then you will, like, maybe you haven't totally gotten them totally all out of your body. So you have to monitor how you feel, knock them back periodically, and or if you're introduced to other parasites, which is part of living on planet Earth, then it's important to be treating parasites at least once a year, probably twice a year for those of us that have had chronic disease. Just like we would with our dogs or our horses or our cats, the vets recommend that we do, the good vets do recommend that we do treat our animals for parasites regularly. And we can get parasites from pets, we can get them from eating in restaurants, we can get them from working in our garden, from the produce that comes in. Parasites are part of life. It's just that we have ignored them in North America. In the developed countries, we've ignored them. And I wonder why that is. Because if we've ignored them and they're causing disease, then there is this market for this multi-trillion-dollar medical system and all of these really expensive immune suppressive drugs that suppress our immune system, right? So we're dealing with a multi-trillion-dollar industry, and that is why we're not treating parasites, because there is no money in treating parasites. So I'd like to share now with you a few of the major culprits in multiple sclerosis, but also in other chronic diseases. I am going to share with you some pictures of some worms that our students have passed. They're pretty disgusting. They're nice and clean, but it's really important that you see what is coming out of our students. I have literally like probably thousands of pictures by now. One student can pass 200 worms, and you wonder, how can you be alive when you pass 200 worms? But it's true. All right, so this is a true picture of Candida albicans. So when Candida is present in our body, in like a benign state, in a state where it is not, this state is not disease causing, those are the round cells. So you'll notice there are a few round cells. So that is not the disease causing state of Candida. So Candida is a commensal organism. It lives in our body in small numbers. It doesn't cause problems if it's present in small numbers. So if we have a healthy ecosystem with lots of health promoting microbes, Candida is not going to be a problem. But it's when we go into the antibiotics that we wipe out a lot of our good health promoting microbes. And then at that point, then Candida starts to morph into this root structure. So it has these long roots that it starts to grow. And that's the hypha form, and that is invasive. It actually breaks through tissue. It'll go through your gut lining into your blood. It will move into deep into our tissue, into our bloodstream. And this is a much more challenging form of Candida to treat. Another problem with Candida and other microbes too is that they produce biofilms. And biofilms are like a slimy coating or a tent that they hide under. This protects them from medications, from our immune system. It's kind of like they have these little communities underneath biofilms. It could be Lyme, Borrelia, Candida, other bacteria. And you'll see the ECM. That's the biofilm for a type of mold, which is a type of fungus called Aspergillus. And on the right, you'll see that there is ECM, which is the biofilm for Candida. So those are actual real pictures of biofilm. So when we're recovering from these infections, we have to consider that they're hiding under biofilms, so we want to treat these biofilms. So there are good biofilms and there are bad biofilms. So if they carry a lot of these parasites, then they're definitely not a good biofilm. So now we're going to talk about a different type of parasite that has been discovered in multiple sclerosis. So Dr. Alan McDonald is a pathologist in the United States, a very well-respected pathologist. And he did this study basically on a shoestring. Like, it didn't cost millions of dollars to do this study. And this is the frustrating thing, is like, why is nobody else studying this? Why won't anyone study? It's not like it's going to cost millions of dollars, but they won't. So he got specimens from a brain bank where there were subjects, like people that had multiple sclerosis that died of MS. So these are confirmed cases. They saved their remains, their spinal fluid, their brain, and he was able to look at them for research purposes. So he looked at 10 subjects of people that had multiple sclerosis and died, and he found in their spinal fluid abundant small roundworms or nematodes, like many of them. He found them in clusters, he found them mating, he found eggs, larvae, he found lots of the guck, their waste material. It was really easy to find these parasites in their spinal fluid. In the brain, it was harder to find, but in the fluid, they could move around, so he found them there. So this is an actual picture of two of the worms that he found. The red arrows point to one nematode, the blue arrows point to a second nematode. And you might be wondering what that fluorescent green dye is. Well, that fluorescent green dye is attracted to the DNA of Borrelia, which is the bacteria that causes Lyme disease. So these worms are loaded with Borrelia. So they infect our central nervous system with Borrelia. So it's not just that we're getting Lyme from mosquitoes, but we're also getting Borrelia in the central nervous system from these roundworms. So, but you can imagine that these worms would cause a lot of damage in the brain, because they're much bigger, and as they're moving around and causing damage, absolutely. So what Dr. Alan McDonald reported on is that there are veterinarians that have known for over 100 years that when these small nematode roundworms, called filarial worms, when they get into the central nervous system of domestic animals, so that would be dogs, cats, horses, goats, sheep, cattle, etc., these worms will invade the central nervous system of those animals, and they have symptoms that are identical to multiple sclerosis, but also to other neurological conditions. So these animals will suffer with debilitating fatigue, numbness, weakness in their limbs, poor balance, spasticity, drop foot, paralysis, and blindness. So, and then these worms, they do carry Borrelia, but they carry other microbes too. So he wasn't looking for, the reason that he looked for Borrelia is because that's his specialty. He definitely is a pathologist that really studies Borrelia a lot. But these small roundworms also carry other bacteria that when we kill these worms, the release of that bacteria can cause really strong immune reactions in the body. And then his more recent work, actually, this is actually a poster of, you can look at it later, and you'll see that there's different worms, they're mating, they're in clusters, they're single, there's larva, there's egg, etc. This is his more recent work where he found, this was August 2020, he published this, and he found developing larvae, so tapeworm larvae, in the central nervous system of every MS subject that he tested, also, again, from those brain banks. So not just the roundworms, but also immature tapeworm, we call them larvae. And so what happens is we'll have tapeworms that live in our gut, and then they release eggs, and the babies hatch, and the larvae can move into different tissues. They can move into the central nervous system. I've done live events on neurocysticercosis. They can form cysts in our central nervous system. They're really linked a lot also with seizures. But he found not only these developing larvae, but he also found, you'll see kind of in the center, it looks like a little worm with a kind of a yellowish green background. That is a developing tapeworm in the central nervous system of an MS patient. So he found those. So Dr. Alan McDonald is the first to discover, to identify developing, or not developing, yes, but just even live parasites in the central nervous system of MS patients at the time of their death. So at the time of their death, he found that they had these parasites living inside their central nervous system. He's the first one. Like, is it that hard? Like, he did this again without a huge budget, without a huge team. Like, seriously? Like, what is going on? Like, we're spending like all of these thousands and thousands and tens of hundreds of thousands on research over the last 40 years, and we have nothing. We're still looking for better ways to suppress the immune system. Something's really fishy. So he deserves, in my opinion, in my humble opinion, he really deserves a prize, a Nobel Prize. Let's talk about Borrelia, which is the bacteria that causes Lyme disease. So Borrelia is a corkscrew-shaped bacteria. It's called a spirochete. It belongs to the same family as the bacteria that cause syphilis. And syphilis has, so like a lot of times doctors or researchers, they'll look at, if they don't know a lot about one bacteria or one microbe, they'll look at another microbe that's very similar in their structure, in their life cycle, etc. So syphilis has a primary, secondary, and tertiary stage of infection in the body. And the tertiary is kind of like the third stage, or the final stage is when it's moving deep into the organs and into the central nervous system. And so this bacteria is present in the central nervous system. It has a special name. It's called neurosyphilis when it's present in the central nervous system. The symptoms of neurosyphilis are very similar to MS again. And so that would be severe headaches, seizures, muscle weakness, trouble with muscle movement, spasticity, tremors, trouble focusing, concentration, dementia, problems with memory, thinking, and decision-making, depression or irritability, changes in vision, blindness, hearing loss, tinnitus, loss of bladder control, incontinence, dizziness or vertigo, numbness, and paralysis. So again, a lot of symptoms that are similar that we would find in multiple sclerosis or other chronic diseases. So neurosyphilis is when that spirochete bacteria ends up in the central nervous system of people that had the syphilis. It's the last stage where it moves deep into the body, and these are in people that have not been treated for years. So interesting that these symptoms are very similar, if not identical, to people that have multiple sclerosis or other chronic diseases. And so there are many studies that link MS to spirochete bacteria. So again, syphilis and Borrelia are both spirochete bacteria. So if we look at all the way back to 1911 to the 1950s. I'm not going to go over all these studies because this is kind of a long topic, but you can go to livediseasefree.com, our website livediseasefree.com. Under research, you'll see them listed there. So there's a number of studies, 1911 up to 1950s, where they really found, and these researchers really believed, that MS was caused by a spirochete type bacteria because of the similarities in the symptoms. And they also found spirochetes in the central nervous system of MS patients. And so just a couple of studies here: spirochetes in MS, spirochetes, the cause of MS, simmering spirochetes in MS by dark field microscopy, spirochetes in the cerebral spinal fluid of MS patients. So they did find them in 1922. They found them in the spinal fluid. 1928, they found these spirochetes in the brains of MS patients. Again, 1933, they found these spirochetes in the spinal fluid again. 1939, spirochete-like formations in MS. 1948, spirochetes in the ventricle fluid of monkeys inoculated from human MS. So many studies, it's not just the similarity between syphilis and Borrelia. They're both spirochetes, they both have the same symptoms, but they actually were finding these spirochete bacteria in the central nervous system of MS patients all the way back in the 1930s. And spirochetes should not be in the central nervous system. 1950, Steiner found spirochetes in brain lesions of autopsied MS patients. 1957, Time magazine reported there was a bacteriologist who successfully cultured a spirochete microbe that she found in the spinal fluid of MS patient. She believed that MS was caused by the spirochete, and early treatment could lead to an improvement of the disease. So tons of research linking MS to different spirochetes. Those are the studies right there. Oops, let me see here. And then if we go on to the next here, let's see. There we go. This is fascinating. So again, Dr. Alan McDonald, an amazing researcher. So this is a cross-section of a nerve axon. So it's kind of like you have a nerve and you just chop it and you look at a side profile of it. So the center is the nerve fiber. So the center is the axon, and you'll see that green squiggly, looks like a worm in both images. And those are Borrelia spirochetes in the myelin sheath of brain nerve cells in Alzheimer's patients. So again, those squiggly green things are Borrelia, which is the bacteria that causes Lyme disease, in the myelin sheath of nerve cells in patients that were diagnosed with Alzheimer's disease. So this is not MS, but this is Alzheimer's. But here it's showing that Borrelia can infect or get into the myelin. So if Borrelia is infecting our myelin sheath, do you think our immune system is going to try to go after it? Yes. Do you think there could be some damage to our nerve cell with our immune system trying to go after these bacteria? They have to kill them or else they'll just keep reproducing and destroying our tissue. So is it that our immune system is attacking the myelin for no reason, or is it that there are parasites in the myelin or close to the myelin, and the war of going after these infections is what's causing the damage, the inflammation? And our immune system is just doing its job. Absolutely. So that is really, really profound. So that's proof that Borrelia can infect the myelin, and it probably likes the myelin. Then we look at the MS Society, and the Multiple Sclerosis Society has shared some really interesting language around this. So they took this down off of their website. I wonder why, but I took screenshots of this. Lyme disease can cause delayed neurological symptoms similar to those seen in multiple sclerosis, such as weakness, blurred vision caused by optic neuritis, also itching and burning and stabbing pain and pins and needles, confusion, cognitive dysfunction, fatigue. Lyme disease symptoms may also have a relapsing, remitting course. In addition, Lyme disease occasionally produces other abnormalities that are similar to those seen in MS, including positive findings on MRI, scans of the brain, and also analysis of cerebral spinal fluid in the lumbar puncture. So they're saying there's a lot of similarities, like MS, we can have the same symptoms as Lyme disease. We could even have the same test results as Lyme disease, but they're different, they say. They're absolutely different. These similarities in symptoms and test results may lead some people to think that MS, may lead some people with MS to seek testing for the presence of antibodies to Borrelia to determine if their neurological symptoms are the result of Lyme disease or truly multiple sclerosis. And the distinction is important because Lyme disease, especially when it's treated early, often responds to antibiotic therapy where MS does not. Well, that's interesting that they would say that antibiotic therapy does not help MS, because I have a blog post. You can look at it later. Does antibiotic therapy help MS? Where I reported on studies that found a significant number of MS patients prescribed minocycline and doxycycline, which are two antibiotics used to treat Lyme disease, responded positively to these antibiotics. 2017 study investigated if the antibiotic minocycline could reduce the risk of conversion of the MS first attack, so that's the clinically isolated syndrome, to a full diagnosis of MS. And interestingly, this study was also financially supported by the MS Society of Canada. Their conclusions in this study is that this trial showed that the risk of conversion from a clinically isolated syndrome of multiple sclerosis at 6 months was significantly lower with minocycline than with placebo, and all MRI outcomes at 6 months favored minocycline over the placebo. So on one MS, maybe it was the American, they're like, no, antibiotics don't help at all. And then the Canadian MS Society, which you would think they would be sharing research with each other. It's the same society, just different branches. They're saying, oh yeah, it actually did help, but more so in the early stages of multiple sclerosis. Crazy. This study showed a significant decrease in the progression of MS, especially in the first 6 months. And it's strange that this was supported financially, this study, by the MS Society, and yet they state on their website that antibiotic use does not help MS patients. In 4 clinical trials, the use of minocycline resulted in less lesions, less relapses, less inflammation, smaller lesion sizes, minimal side effects, and less disease severity in the 6th month of the study, but not at 24 months. So again, these parasites, they don't stay in your blood, they move into your tissue, and over time, the antibiotics are not going to be very effective. So they're not the best treatment. Now we're going to cover on a topic that is really near and dear to my heart, because I think that for me, this was one of the main parasites that was rearing its ugly head, just because I have so many different, or had so many different symptoms, whether it's blood work that shows, abnormalities with your red blood cells, the symptoms of babesia, malaria, chronic, right, not acute. Just so many, so whether it's the symptoms, whether it's your blood work, all of that, all linking to this parasite, which is a malaria, babesia type protozoa, a single cell parasite that infects our red blood cells. So it may not be babesia, it may not be malaria, but it is something similar, like a cousin, that will infect our red blood cells. And this is really why I believe that a lot of research are saying that MS is probably more of a vascular disease than an autoimmune disease, because of all of the vascular issues that we're dealing with. So again, over 100 years of evidence that there is this protozoa that infects our red blood cells, and that is really linked with multiple sclerosis. So malaria can cause a demyelinating disease of the central nervous system, very similar to multiple sclerosis. Malaria and babesia are both protozoa that infect our red blood cells, and there are at least 75 scientific papers dating back to the late 1800s, so 1880s, that discuss that a malaria-like organism was discovered in MS patients. In 1899, researcher Manneberg was probably the first to believe that MS was caused by a malaria-type infection, and MS patients treated with anti-malaria drugs in the 1920s and 1930s, when there was a big malaria outbreak in the United States. And so MS patients were also given the anti-malaria drugs, and they had huge reversals of their disease. It was like, what is going on? So more recently, Dr. Fry from Fry Labs, he also discovered, he believes it's a different type of protozoa that is present in MS patients. And then I reported on a new study, recently, 2021, September, a study that was published entitled Hydroxychloroquine for PPMS, primary progressive multiple sclerosis. And they found, and I did a blog post on this, so an article on our website, livediseasefree.com, is called MS News, Malaria Drug May Be a Promising Treatment for PPMS, because there's very little options that our healthcare offers for progressive multiple sclerosis. But in this study, they concluded that in people with PPMS, hydroxychloroquine treatment was associated with reduced disability worsening. Hydroxychloroquine is and they felt that it's a promising treatment candidate for PPMS, and it should be investigated further in randomized controlled clinical trials. Why is it not being tested? Well, if you were a company and you had a product that was selling to your customers for like $150,000 a year, and you had this other option that could be promising, it might even be better, but it might, your patient might spend maybe $100 a month, so let's say $1,000 a year instead of $150,000 a year. Are you going to investigate that cheaper drug? Of course you're not. You'll say you can't afford to. So this is the problem with our healthcare. We can't expect pharmaceutical companies to want to investigate and find cures, because it's not in their best interest to find cures. So this is where our government is supposed to protect us. It's supposed to make sure that the interests are going towards finding a cure. They're not looking for a cure. There's no money in a cure. And we're not going to ever have a cure if we don't have an honest healthcare system. And right now our healthcare system is not an honest healthcare system. Are you ready for a couple of worm pictures? Are you ready? Okay, brace yourself. Here it comes. Oh, disgusting. Okay, so these are just a very few of the pictures that our students are passing. And this is not just MS, but other chronic diseases. So again, I shared more recently that one of our students who's a healthcare professional, she had a demyelinating disease, not multiple sclerosis, but a different one. And she documented 200 worms. That is not uncommon for people that are really sick. And she's not old. I'm guessing, I can't remember exactly. I'd say in her 30s, 40s, maybe. Beautiful, like she hasn't been disabled for years, but she's been carrying this burden. And it's so shocking for people when these parasites start coming out, and you're just like, what the heck? Like, how is this possible? I myself have passed over 2-foot worms. I've passed many flukes, intestinal flukes. It's like really? Like it's so mind-boggling to see them coming out when they're dead. Of course they're dead. They don't hurt when they come out. But people notice a significant improvement when we pass them. So these large worms are probably not the only cause. We talked about Borrelia, we talked about Protozoa, bacteria, with fungi, and I'm sure there are some others that we haven't identified yet. I think we've probably hit on some of the bigger culprits, but the big worms, the flukes, especially the flukes, they cause a lot of inflammation in the body, like a lot of inflammation, more even than the roundworms or the tapeworms. So just know that you probably have multiple parasites, like parasitic worms also. And when you treat them, it is really life-changing. Like you notice really significant improvements in things like spasticity and strength in your legs and mental clarity. So cognitive function, strength in your limbs, the spasms, the stiffness going away, the edema, like all those things. And if you have 200 worms and you pass the first 2 or 3, you might not notice a lot of symptom improvement, but as you keep working away at it, then all of a sudden you hit this critical mass where you just kind of tip over the edge and you're like, oh my gosh, I'm starting to sleep better. Oh my gosh, I'm starting to get this numbness going away and this tingling going away and spasms going away. So it is, again, the burden that we have in our body that really determines how sick we are. So it is really, truly, that has been mind-boggling. We have to use parasite drugs and herbs and oxygen therapies, all 3 together. And remember, I shared the steps with you that we first support the body so we're ready to treat. Then sometimes we need to take binders. Sometimes if we're killing some of these big worms, we can have a little bit of a die-off reaction. But if we've really prepared ourselves, then we can tolerate it really well. So we do that with our students. We really help them to build a plan that they tolerate. Some of them are still working and they want to keep working. They don't want to be flatlined on the couch feeling horrible and weak. So there is no benefit in a Herx reaction. We want to avoid a Herxheimer reaction as much as we can. So again, the steps that we do to treat these parasites, these infections that cause MS. So this is the biggest cause. This is the cause of MS. We don't need to wait any longer. We have tons of evidence. Maybe our standard of care has been hijacked. Maybe they're not interested in this evidence, but that's too bad. We don't have to wait for them. We can recover. We can move on with our life, get our health and our life back. But to do that, we have to first stop feeding the infections as much. They will still live on our normal blood sugar levels, but you will notice a significant symptom improvement. I have one student, teacher in the moment, I won't say who it is, but she doesn't have MS, but she has, she's so sick. She's been going to different doctors, and the doctors have been giving her all these parasite drugs, and she's been feeling worse and worse and worse. Severe inflammation all over her body and in her mouth, like trigeminal neuralgia. People get to the point where they almost want to give up, right? They just almost want to give up. And she kept fighting me on the diet, and she's like, I'm doing the diet the best I can. I know that's not the problem. I'm like, yes, that's the first step. No, I'm doing really well. I'm doing really well. The diet isn't a big deal for me. No, you need to start the diet. So after going back and forth over 4 weeks, she finally is starting to really hone. It's not perfect yet, but she's finally starting to really hone in, because she's like, I can't carry on like this. I'm going to die if I don't get some relief. And so literally within less than a week, she's starting to have like tiny little symptoms, and she still had a little bit of a complex carbohydrate, but definitely less. So some of our students, most of our students, they just like follow to a T. Like day one, almost to a T day one, but within the first few days, they're just following it. And you can have symptom improvements literally within a week to 2 weeks. So that's what you should notice if you follow the guidelines. But if you want to recover, you have to treat them. If you have a doctor that doesn't know how to help you, we will help you in the Live Disease-Free plan. So I think that is it for... Oh, I just wanted to share this because this is one of my favorite mentors, Dr. Klinghardt. He shared, our health at birth is influenced much more by the microbes that we inherit from our parents than the genes we inherit from our parents. That is truly profound, because we may have certain genes, but if they are turned on and off, largely a really big factor of that is the types of microbes that live inside of our body. So that is truly amazing. We must determine what is interfering with our body's ability to run optimally, and we address this. Instead of we don't suppress the immune system. We need our immune system. We support our immune system. We take the pressure off our immune system to support the body naturally so that it can do what it is designed to do. What a simple concept. And that is how the Live Disease-Free Wellness Champions are recovering. Maybe this is the first time that you've found me. Maybe you have not heard about parasites before. You didn't know that we knew what caused MS, and this is giving you a ray of hope. This is why I'm sharing this with you. I'm really hoping that you see that there is a better way for you. And this year, is this going to be your year where you take charge of your health? You take a different path like I did. It has paid off so much for me. I've had almost just too full of a life, but I think that's number one, our personality, those of us that get sick, we're usually kind of our overachievers. But then secondly, when you get your health and your life back, there are so many things that you want to do that you never thought you would be able to do again. So where you go from here is number one, build up your belief that you are dealing with infections. I've got tons, and I'm going to take you on a journey this year. I'm going to take you through, we're going to go deeper dive into the roundworms. We're going to go deeper dive into the flukes, into the fungi, into the Lyme infections, and into the malaria babesia. I'm going to take you deeper into each topic so that, I'm hoping, number one, that it will help to build your belief system, but more importantly, I'm hoping that you will share all of this so that we can bring change. That is the goal before my retirement, is I want our practitioners to be treating patients. I want them, they should be treating, they should have this skill. It's a very simple skill. We actually don't need all these different specialties in healthcare, because if your general practitioner recognizes basic parasite symptoms early on, before you have chronic disease, those can be corrected, those parasites can be treated, and then you never end up with chronic disease, right? It's still important to eat healthy, to exercise, but if you don't manage the microbes that live in your body, we still become sick, because that is the biggest cause of MS and other diseases. I'm going to go really quickly to your questions because I know we've gone on a long time here. Hi, Wilma. Thank you. Oh, Scottsdale, Arizona is awesome. So you have secondary progressive multiple sclerosis. Please review all my information. So it doesn't matter if you have primary, secondary, relapsing, remitting, you're dealing with a parasitic infestation, and as you treat the parasites, you will stop the progression of disease, of MS, and you'll have more recovery than you ever thought possible. You'll be able to come off of your medications when you're ready, because none of the MS medications, they don't help us. They just suppress our immune system. And your immune system is not the problem. The problem is a parasitic infestation. And I just shared some research today. You're on 18 prescriptions. I am so sorry. You totally can. But again, you have to work with a strategic plan. You have to work slowly. You have to work with your doctor, with your pharmacist as you're feeling better. They'll tell you how to come off medications safely. Some medications you cannot just quit cold turkey or you'll get really sick. It can happen, but you have to take a different path. Hi, Jennifer. You were performing fill violin shows within, you were performing full, sold out fiddle, violin, dance shows, and within weeks, everything changed. I am so sorry to hear that. And also with small children. So Jennifer, make sure to check out I think the best thing to do is go to our website, livediseasefree.com, under blog, start looking at all the different articles that I've written. Just start to absorb. So there's the shorter videos there. There's my notes you can scan, and you'll just be binge going through it. And it's so exciting because it's going to answer so many of your questions. You can get your health and life back. Actually, that healthcare professional is back to tap dancing, which is so cool. And she's not even 100% done treating yet. So there is hope for you too, Jennifer. Tanya, how do we treat these silent infections? So again, we have to get ready to treat. When we get to the treatment phase, we get energy tested because we don't have good stool tests. I'm going to talk more in detail about that later. We've kind of gone on probably long enough. But so with the treatment, we do cycles. We treat big to small, and it's about a month treatment cycle of treating the larger worms and protozoa, then treating fungus. Then we take a break from the pharmaceuticals, but we're still using oxygen therapies and herbs. And that's one cycle, and we do multiple cycles from big to small, just knocking it back, building back the good microbes as we do all of this. And again, we have to use the parasite drugs that test well for us based on energy test results. And I'll talk more about that in a future video. I'm so glad that you've enjoyed it. Thank you for your kind words. And how does one know or test for worms or flukes? That's the problem, is we don't have good tests. The very best test that we have will pick up maybe 10% of the parasites that we have, according to very well-respected parasitologists. So instead of trying to figure out which parasites we have, we use energy testing, like applied kinesiology or some kind of advanced muscle testing or machines that will determine which parasite drugs test the best for us. So if you test well for 3 roundworm medications, you probably have roundworms. If you test well for tapeworm medications, then you probably have tapeworms. So that's how we do it. And so then we just use the parasite drugs that test well for us. You're so very welcome, Jill. What test do we ask for our functional medicine doctor to test for flukes, worms? I personally, and with our students, is that we don't recommend testing. Like if you work with a healthcare professional integrative, you can spend thousands of dollars on testing and you're not going to find the results. So usually functional medicine doctors, they do not know how to do energy testing. It would be a different type of practitioner. And it's not very expensive. You're only wanting to be energy tested. You don't want to do a whole bunch of other things. So it might be $200 to $300 for energy testing, and it's a one-time thing if they are a skilled practitioner. 25 years of sickness in Canada. There is not a doctor with a critical thought anywhere on the prairies. Well, Phil, if you think about it, they've gone to school for so many years. They have been trained in a certain way of thinking. They're not even allowed to think outside the box. If they look outside the box, if they consider parasites, they will lose their license. If they think you have a parasite, you have to get a parasite stool test done. In Canada, the stool tests are terrible. We've even had students put worms that they've passed in their stool test and it comes back negative. They don't even look at it. I don't know how they're doing this. I don't know if they just put all the stool in like something to mix it up and they just centrifuge it and they take some of the fluid and they're looking for smaller parasites like the Protozoa bacteria and things like that. But it's pathetic. I think I've heard from one of our students, and she checked into this, that in British Columbia, they're not even looking for worms. That's just not part of what they're looking for in the stool test. So it is really awful, and that's why it's really important to take a different path if you want to recover. So yeah, we don't have a pharmaceutical deficiency anywhere here on the planet, but it's really sad. So how do colonoscopy procedures not help? So why do they not help? So a colonoscopy is only looking at your large intestine, and you can go on YouTube and you will find that there are colonoscopy where they show worms, that the doctors found worms when they were doing a colonoscopy on their patient. But most of the parasites like to live in the small intestine, and the colonoscopy is not reaching that area. So the colonoscopy is just looking for areas of inflammation. That's basically it. So and sometimes the parasites will hide in folds so they can get missed. So unfortunately, they're not looking for worms. And it is shocking. You would think that they would find worms quite regularly because our students do pass them. But again, the parasites do hide they hang on and they hide, and they also live mostly in the small intestine where the colonoscopy procedure is not done. What is your opinion about ivermectin? So ivermectin is helpful for treating certain parasites, but it is not a cure for MS. It is not something there's not one single student that I work with that is just using ivermectin to get well. Like, some people test well for it, some people don't. It really depends on the types of parasites that you have. Unfortunately, there's not just one parasite drug that treats all the parasites. Last question here. I'm going to let you guys go. So Dante is recovering from Lyme disease thanks to my program. He's a student right now in the program. And yes, he has Borrelia probably. It's really hard because even the blend of herbs that we use for treating Borrelia, they will also treat Babesia and there's other co-infections that travel together. We've even had our students that are using, like cocktails of liposomal herbs for treating Lyme that have passed large worms. So there is some overlap, but we have not been able to help people to fully recover with just herbs alone. The parasite drugs, they're not a magic cure, but they're definitely really important, along with the oxygen therapies. And also Dante is using all three of them. So it's really important to use like a real strategic approach to treatment, because otherwise you just don't get well. And the unfortunate thing is, I believe that our doctors, they probably want to get into the profession because it's a very well-respected profession where you are supposed to be helping people. I wanted to be a nurse when I was a little girl. I thought the hospitals were just so amazing, and I wanted to be a nurse. And then when I got sick with MS, I was just like, wow, like learning all of this. And then what happened in the last couple of years with that condition that I can't even say what it was, that shut the whole world down, and how our doctors were not allowed to treat patients, how they were told, send your patients home. If they're dying, bring them in. They can get oxygen vented, and they can end up with a certain medication. And a lot of them died, and so gut-wrenching. So the ugliness of that, what came out at that time, is the world that I've been living in trying to help people recover, how this is really, really preventing us from finding a cure. And one of my students, I don't have it up here, but I'll look at it. I think I might do a topic on this next time, but there's an article, and they're actually calling like a psychiatric disorder when you believe you have parasites. It's like parasitosis, like psychiatric parasitosis or something like that. So demeaning, so disrespectful. And this is where, some of these, and this is not all doctors, there's a lot of doctors with big hearts and they really mean well and they're doing the best they can in the system and they know it's not a perfect system, but boy, some of them are so arrogant and so awful. And then you wonder too, like, is it some influence from some of the companies that are funding this type of studies where, this one person thought they had Lyme disease and another one thought they had ropeworms, and just really attacking people that are desperately trying to get well. And they do probably have Borrelia and they are passing ropeworms. So it's just absolutely horrendous, the battle. But the good thing is there are people, this is my battle that I'm doing. Like, there's so many battles. I live in Canada and I'd love to be, like, our government is out of control, our healthcare system is out of control, and we can't fight everything. So this is the fight that I have to do. This is what God gave me to do, and I'm trying to fight. And what you can do is you can help spread the word. This is the age of awakening. This is the age of where, like, if we want our freedoms, I grew up in Canada and I thought I had a whole different outlook on what Canada was. And now I'm seeing that, my goodness, if we do not fight for our medical freedom and fight for our political freedom and fight for, just stand up for it, and we will lose it, and we will be we think that is bad now, it will be a lot worse. So again, number one, if you like what I'm sharing with you, if you find this really helpful, if you find this life-changing, please like, share, and subscribe. That helps it get out to Facebook. I've had a huge decrease in people seeing my content. I used to have, if you look at my earlier videos, there's like 100,000 views on it. So they've really been suppressing this information, understandably, but we're still making a difference. And the more of you that share this, we can outsmart those algorithms. And then if you're at the place where you're like, Pam, I've been following your work, I truly believe this is what I need to do, then make sure, if you need support, make sure to watch my masterclass training, or even if you just want to know the steps in better detail, watch my masterclass training. I go into a lot more detail, a lot of case studies of people that have recovered. Watch the successes on YouTube. And if you need support, make sure to fill out the form and book a time to chat with me. You can join at any time, become a wellness champion, and this can be the very best year you've had in many, many years. Take care and bye-bye for now.